Welcome all to the Michael Curtis PT Clinic. Today we're examining Samuel Power's case of whiplash.
He reports that he went to the ER after being involved in a car accident. Let's take a look.
Making my way downtown, walking fast, faces passing.
Now, Samuel reports having neck pain after having been in a car accident. He was hit from behind and he didn't see the other car prior to the accident, so he wasn't able to brace for impact. He stated that he initially felt okay and told the EMTs he didn't need to go to the hospital, but the next morning he began to feel pain and stiffness in the neck. The patient does not report having a headache and he complained of no other symptoms.
We determined 6 muscles directly affected by Samuel's accident. These were the trapezius, sternocleidomastoid, levator scapulae, and the 3 scalenus muscles, as well as the suboccipital muscles. Let's get a better understanding of what each of these muscles are and what they do. We're looking at the trapezius. The trapezius is a large triangular muscle that spans over the upper back and shoulders. The origin of the trapezius is the occipital bone down to the vertebral column. The insertion is the scapular spine and clavicle. The function of the trapezius is to extend your head, elevate, depress, and adduct.
Now let's take a look at the sternocleidomastoid. This pair of long muscles' function is to flex the cervical vertebrae, the top 7 vertebrae of the spine, in lateral flexion. This is a movement of the head and/or trunk away from the midline. The sternocleidomastoid originates at the manubrium of the sternum and the clavicle, and its insertion is at the temporal bone of the skull.
Next is the levator scapulae. This long muscle of the shoulder girdle originates on the posterior tubercles of the cervical processes 1 to 4 and inserts on the upper part of the scapula. Its function is to raise the medial border of the scapula.
Our next group is the scalenus muscles. This is a group of 3 muscles that consists of the scalenus anterior, posterior, and medius. Let's start with the scalenus anterior. It originates from the anterior tubercles of the transverse processes of C3 through C6, and its insertion is onto the scalene tubercle on the inner border of the first rib. Its function is to elevate that first rib. Moving on to the middle scalene. Its origin is from the posterior tubercles of the transverse processes of C2 to C7, and it attaches to the scalene tubercle of the first rib. It also functions to elevate the first rib. Now moving on to the posterior scalene. It originates from the posterior tubercles of the transverse processes of C5 to C7 and attaches onto the second rib. Its function is to elevate the second rib.
Lastly, we have the suboccipital muscles. These small muscles at the base of the skull originate on the posterior tubercle of the second cervical vertebra and insert on the transverse process of the C1 vertebra. Suboccipitals act to rock and tilt the head into extension.
Now, with all these target muscles in mind, we formulated a few key exercises for Mr. Powers to practice and aid his whiplash injuries. Now, the first exercise is, our first exercise is going to be a single arm shoulder shrug. This is going to focus on the trapezius, the large triangular muscle at the top of the back that spans over the shoulder. So, this is going to be an isotonic contraction of the trapezius. Our patient is going to put their arm by their side, and while using that trapezius to contract, they'll lift the arm and the shoulder closer to their ear. Now, over time, when this becomes easier, the patient can work with a resistance band or add some weight to it to increase the difficulty. Now, our next exercise is not necessarily an exercise, but more of a stretch. So this is going to loosen up the trapezius, so we should do this before exercise as a dynamic stretch. So our patient is going to put their arms by their side, and in a very slow, controlled manner, they're going to shoulder roll. So they're going to roll their shoulders back 5 times, and then they'll reverse this and do it forwards. Okay, our next exercise is the final one for the trapezius, which is a prone shoulder horizontal abduction. So our patient is going to lay face down on the table. She's going to place one hand under her chin and extend one arm off the table. She's going to turn her palm so that it is facing her head, and she's going to lift slowly and carefully so that it is at 180 degrees to be even with the shoulder. Now she's going to lower it back down, and she's going to continue this isotonic movement to strengthen the trapezius. Weight can be added if it needs extra difficulty. Okay, so our next exercise is going to focus on the sternocleidomastoid as well as our levator scapulae. So we're going to take our patient and have them place their left hand on the opposite side, so their right side of their head. she's going to use her hand and gently tilt her head towards the opposite hip. So in this case, she'll be tilting her head down and towards the left hip. Now, she'll feel this stretch down the side of her neck. This is an isometric exercise. Okay, so our next neck stretch is going to focus on the sternocleidomastoid as well as our levator scapulae. So our patient is going to tilt her chin down towards her chest. She's going to hold this stretch as it is an isometric exercise. Now, she's going to hold this for 10 seconds and then rotate a bit to her left, pointing her forehead towards her left shoulder, and then hold that for 10 seconds, and then rotate to the right, holding it towards her right shoulder. Our next exercise is a neck retraction. This is going to focus on our trapezius muscles as well as our suboccipital muscles. So our patient is going to take their chin, we're going to pivot around our neck. They're going to point their chin down towards their chest, drawing it in. And then as this stretches your suboccipital muscles and your trapezius, and then we're going to continue this isotonic movement by tilting her head up and looking directly at the ceiling. Now she's going to continue this motion moving back and forth to further strengthen these muscles.
Outside of Mr. Powers' exercises, there were some things we added to his treatment. We asked that he wear a neck brace in order to support and protect his neck as he continues building muscle. We also asked that he pay close attention to staying hydrated and increasing his intake of sodium, potassium, and calcium in order to have the correct ion balance for muscle contraction.
This is where actin and myosin, two proteins in his muscles, are repeatedly attaching and pivoting in order to shorten the sarcomere. When the sarcomeres in your muscles are all shortening, this is what causes your muscle to contract. Mr. Powers is no longer experiencing any pain or stiffness in his neck. His pain severity reduced from a 7 to a 2 on our scale. Because of this, we recommend that he continues these exercises for about 4 weeks, performing them 3 to 4 days a week, until all of his pain is reduced.
If you have any further questions, please contact the Michael Curtis Clinic. Set, go.
Today, oh wait, fuck. Welcome all to Michael Curtis.
Stop! Don't laugh at me! I'm sorry. Behind, and he didn't see the other car prior to being hit, so he wasn't able to brace for impact.
Accident. These were the trapezius, sternocleidomastoid. These were the trapezius, sternocleidomastoid.
Stop! Pull her head to tilt and tilt towards. This is going to focus on the scapulae as well as the capitis muscles. So it's Mom!